From the WKYT studios in Lexington, this is Kentucky Newsmakers with Bill Bryant.
Good morning from WKYT News. I'm Bill Bryant, hoping you're enjoying your weekend. Later, Kentucky's Commissioner of Veterans Affairs and former Miss America Heather French Henry. As we head toward Independence Day, we'll talk about how Kentucky is trying to support the men and women who have served America. That's later on Kentucky Newsmakers. But first, historian Ron Bryant is here with some perspective. After the violence that left 9 African Americans dead in South Carolina, a movement has quickly led to the Confederate flag being taken down in many public places and banished from store shelves, and there are calls for other things to happen. In Kentucky, there is a move afoot to remove the statue of Kentucky-born Confederate President Jefferson Davis from the state capitol rotunda. It was placed there in 1936. We're going to talk with Ron Bryant about that and how Independence Day is observed around the nation and here in the Commonwealth as well. A very timely discussion. Ron, thanks for coming in. We appreciate it very much. Thank you for having me. And again, what we are going to endeavor here to do is just get a historical perspective on where things are. Many southern states quickly moved to remove the Confederate flag from highly visible public places after those worshipers were horribly murdered in that attack in South Carolina. What do you make of the events of the last 10 days or so?
Well, it's a cultural phenomenon in many ways because the states of the old Confederacy, for example, have always been very dedicated to the symbols of the Old South, the symbols of the Confederacy. But there has been so much controversy over the last few decades about whether they should still be represented in public. Historically, they are part of American history. It is something that as historians we do not judge one way or the other about what is good or bad. We just look at it as a very, very, shall I say, unbiased. But it has been very swift. It has been surprising how swift it has happened and quite shocking in some cases.
Symbols mean very different things to different people,
yes,
right?
Yeah, there is no way that one can look, for example, at a Confederate battle flag. If you are from one perspective, you will see something that is totally different. If you are a person who has Southern heritage and looks at it just as a historic symbol, you'll look at it that way. But the divide is there, and it is something that has become very, very controversial.
And many obviously see it as a symbol of slavery and bondage.
Yes, that is very true. And of course, in history, when we talk about the Civil War, that is one of the most complicated portions of American history. You will have as many historians on one side as you will the other. And again, history's purpose is to look for the truth about situations. And symbols, unfortunately, is like Napoleon Bonaparte said, men will die for baubles. I mean, a symbol of a flag or a symbol of a medal, people will go to their deaths over that.
It was very complicated in Kentucky, a border state, right?
More complicated than probably the rest of the country. Kentucky was so divided during the Civil War that honestly, at one point, people in this country were thinking we had 3 nations. We had what was left of the United States, we had the Confederate States of America, and then we had Kentucky, which had declared its neutrality, which was an impossible thing to do. And when we look at it, Kentucky provided far more soldiers to the Union cause than it did the Confederate cause. But you would not know that in post-war Kentucky. For example, we were one of the wealthiest and most influential states in the Union in 1860. In 1865, that was pretty much gone. And even though Kentuckians had supported the Union, you know, for the majority when the war began, they wanted to save the Union, but they wanted to keep their slaves too, which is ironic because most Kentuckians, like most Southerners, did not even have a slave. But in some cases, it was a thought of property. You know, this is my right to hold property. And that was one of the arguments. And some Union officers from Kentucky resigned their commissions after the Emancipation Proclamation was issued, and that didn't even touch Kentucky. The 13th Amendment to the Constitution is what abolished slavery in Kentucky.
Why was the Jefferson Davis statue in the state capitol to begin with? How did it get there?
That was something that the United Daughters of the Confederacy decided that they want to memorialize Jefferson Davis, who was a native son of Kentucky, as Abraham Lincoln was. And so they started a fund to create a statue. And of course, you know, in the rotunda we have statues of famous Kentuckians. And they felt that it was very important to place Jefferson Davis there, especially with Lincoln having the pride of place in the middle of the rotunda. They ran out of money. And so the state took it over and actually paid for it. And so that is how it ended up there. It was just a memorial to what is called so much the lost cause. And that was very popular, especially in the late 19th and early 20th century. There were monuments being put up all over the South. And the United Daughters of the Confederacy, Sons of Confederate Veterans, all of these people worked very hard to make sure that there was some kind of monument to the people who had fought for the Confederacy.
Well, his focus on the statue in Frankfurt at this point, and the state is taking comment right now about what to do and whether they're going to move it to the History Museum or some other location, but there are other monuments around the Commonwealth
all through
as well.
the state. There are far more Confederate monuments in Kentucky than there are Union monuments. In fact, it is overwhelmingly so. Many counties will have a statue of a Confederate soldier. Many of them are on the courthouse lawn. Many of them are in cemeteries. Of course, that could be considered private, but the courthouse lawns are public. So they're there, and many of them have been there for 100 years.
All right, so the decision likely to come in late July on that. All right, another matter. It has been suggested by flag experts who took a look at state flags across the country, and it's been written about by a Herald Leader a columnist, that Kentucky's current flag could use some kind of makeover or change or be different. But there are many who like the simple state symbol and its powerful words, united we stand, divided we fall. One description of it was the state symbol on a bed sheet. Ron, how does that hit a historian?
The Kentucky state flag is actually aesthetically very acceptable. Dark blue backgrounds are on many state flags, and they put symbols. Indiana has a dark blue background, but they have another symbol on that. Kentucky actually uses its state seal, and the old state seal would have caused probably more controversy because the two men who are shaking hands now on the state seal and on the flag were actually hugging each other in the old state seal. So you can go through all of this. The Kentucky flag is very dignified, I think, and I think it's a very, very nice one. Historically, it's very accurate, too, because it shows two people shaking hands, united we stand, divided we fall. Very simple.
And a Kentuckian designed the flag.
Yes, there was an art teacher in Frankfurt.
I was going to say it was not a graphics company,
no,
but it was.
No. But if you look back at old flags of Kentucky, they looked very similar in many ways to the one we have now.
As America celebrates Independence Day coming up later this week, what traditions are being renewed across the country and here in the Commonwealth?
Well, the 4th of July has always been one of Kentucky's most favorite holidays, and through the years we have celebrated it in very varied ways, sometimes very raucously. In the old days, people would go out and have shooting matches to show their marksmanship. They would have gander pullings. They'd tie a poor goose to a stake and ride bareback on a horse and try to pull its neck off. But all of that was just part and parcel of Kentucky's frontier heritage. But we love the 4th of July. We liked that much better than we did Christmas.
You've often made the point that we celebrate the 4th, Independence Day, essentially on the wrong day.
Well, if you wanted to put it exactly on the right day, it would be July the 2nd. But ever since the beginning of this country, we have always said July 4th because an official signing was done on that day, but it was actually passed on July 2nd.
And you say there's some other myths around that time.
Oh, there's so many myths about the American Revolution and the 4th of July celebrations. Paul Revere, one of the most beloved stories in American history, is basically in error because Paul Revere never really made that famous ride. He did ride some, but he was arrested very quickly before he could get out of Boston. And he did finish a ride, but Dr. William Dawes is the one who spread the word about the British are coming, and I've always said when the poem was written, Paul Revere's Ride, it would not sound correct to say, "Listen, my children, and you shall hear of the midnight ride of Dr. Dawes." It just falls flat.
Well, in any case, thank you very much for coming in and giving us
welcome.
some perspective this morning.
Very
Ron
welcome.
Bryant, historian. And we are back in just a moment. We'll be visiting with Kentucky's Veterans Affairs Commissioner Heather French Henry on Kentucky Newsmakers. Welcome back to Kentucky Newsmakers here on WKYT. There are some 340,000 veterans in Kentucky, men and women who have served our country and in many cases put their lives on the line for our freedom. In this week leading up to Independence Day, we're even more mindful of what they've done for us. And yet we all know that the U.S. Veterans Administration has been trying to address some major problems with health care, including psychological support for former service members. The Commissioner of Veterans Affairs in Kentucky is former Miss America, Heather French Henry. The department works to make veterans more aware of and how they can obtain their benefits. It also works with homeless veterans and oversees long-term health care facilities in the state as well. Commissioner, thank you very much for coming in. As we said, in this special week that's ahead. And this is more than a job for you, isn't it? That you see this as a mission that you feel toward veterans?
Absolutely. You know, first and foremost, I'm the daughter of a veteran, and I think too often we don't look at families of veterans as great resources. We tend to be a primary line of defense for health care, for mental health care within those communities. Our veterans, when they go to a hospital and they get seen by a doctor for a moment or maybe in the hospital for a brief stay. But the family unit can comprehensively take care of that veteran. We see unique triggers, you know, if my dad's having a good day or a bad day, if we're going into public situations where already the family members know, oh, this is not going to be a good scene. So we are kind of the first line of health care and mental health care defense for those veterans. So from my Miss America year till now, for the past 15 years, I have been working not only in the state of Kentucky, but around the country and also in Washington, D.C. to talk about legislative issues for a variety of issues pertaining to the Department of Veterans Affairs. Homeless veterans being my initial, because my uncle was a formerly homeless veteran, and substance abuse and mental health are all components of homeless veterans reintegration and programming. And then now working on some even outlying areas like women veterans initiatives, military sexual trauma, access to health care with the VA. Although we don't oversee through the department the VA medical centers, we certainly are strong advocates and partners with them to make sure that we are removing any barriers for a veteran to seek health care and benefits through the VA. So it is much more than, it is such a passion for me, certainly.
Well, and the Veterans Administration, as you noted, has had very well known and documented and public problems in recent years. Horrible waits for care, some appointments that were never satisfactory to those who went to see healthcare professionals. Is the status improving from what you observe?
The status in all of our partnering VAs throughout Kentucky, of course, we're not state boundary lined for our health care. We deal with 5 to 6 other VA hospitals: Cincinnati, Lexington, Louisville, Huntington, Nashville, Marion, Illinois. They all serve catchment areas within the state. All of the surrounding VAs that we deal with, including Lexington, have always had very satisfactory low numbers when it comes to wait times. Unfortunately, when the VA gets hit with a problem, now for every one problem they have, they do have a million success stories. I do want to say there are only nationalized health care. They do an extraordinary job with the tasks that they're given. So when we had the issues with, say, Phoenix, those were not really indicative of issues that we may or may not have in Lexington. But unfortunately, it's one VA system. But as many of us who've dealt with the VAs understand that once you've been to one VA, you've been to one VA. Each VA has an administrator and staff that are very important in creating the atmosphere and doing the systematic programming for those particular facilities. And I will tell you, here in Lexington, especially with the dual campuses that we have here with Cooper Drive and Leestown, you've got phenomenal facilities here. It's always had low wait times. And any time that we have had a veteran come to Kentucky Department of Veterans Affairs with an issue, we're able to help them successfully navigate the system. I'm not saying that it's 100% problem-free, certainly, but a large set of problems that we see are when a veteran doesn't know who to talk to when there is a problem. So we help facilitate that role.
And that's what I wanted to ask. How often do veterans not know of services that may be available to them. And how often does your department step in and assist with that?
Well, let's give you a national perspective. So of the 23 million or so veterans, and that's an estimated number, roughly about 8.9 million use the VA. So you have a majority of veterans who are not VA-involved veterans. And that's where the mission from the federal department and the State Department differ. The federal department, of course, it's the Department of Veterans Affairs. They deal with the medical community, right? So they're dealing with VA-involved veterans. They do outreach to get more veterans in, but within the State Department of Veterans Affairs, we don't make that division of we only are here to care for VA-involved veterans. We're here to care for all veterans. And we do understand that there may be veterans who either don't want to use the VA, have private health care insurance that's taking care of them right now, although we do encourage more veterans to seek out their benefits, claims, disability, to seek access to the VA health care system. And I think that one of the fundamental reasons is, one, they're due that from their service, certainly, but also because of the uniqueness of each person's military service and where they may have served or era of their service, there may be medical issues associated specifically with their time of service. And if we don't know where they are and they're not in the system, they may not be getting that information. So case in point, a Vietnam veteran. Well, most of them are going to be at the age that they should be getting prostate cancer screenings already, certainly, just because they're men of that age. However, because they're Vietnam veterans and if they've had exposure to Agent Orange, which most of them are presumed to have had that exposure, they are higher at risk for prostate cancer. But if a Vietnam veteran has not come to the VA and had an Agent Orange exam and asked to get those PSAs done, a normal urologist out in the community, even if they might know that their patient's a Vietnam veteran, may not be aware of that heightened risk for prostate cancer in association with Agent Orange. So there are some fundamental differences between civilian health care and VA health care that lead me to believe that we'd like to get as many veterans as we can into the VA health care system.
At the lowest point, there is homelessness and, worse yet, a high suicide rate among those who have served our country. That has to be disturbing and yet a problem that you're just eager to try to tackle in both of those cases.
Well, let's start with homeless veterans. So in 99 and 2000, when I became Miss America, homeless veterans issues was my primary focus. At that time in the country, we had over 250,000 homeless veterans on the street. So over 15 years, we've seen a dramatic decrease because of the amount of services that are available now in communities. And we have seen some new resurgence with the mayor's challenges across the country, different governors. I know Governor Beshear signed the proclamation as well. And it's not just about getting to a zero, but we're now below about 46,000 homeless veterans nationwide. Of course, as I feel, if we have one homeless veteran, that's one too many. It's an issue that we're always going to have to tackle. Now, how we tackle it's going to be the initiative. So now we have created this great resource of services, whether they're veteran-specific or partnering with other agencies, so interagency cooperation, that can help us facilitate once an identified veteran is homeless, then we can, hopefully we will get to a point where under 30 days we can get them access to housing, mental health care, substance abuse, whatever they need, we're able to give them a more sustainable, better quality of life. So that's the real success. But we have seen the numbers go down dramatically, and I'm certainly thankful for that. For the suicide rate, you've got a little larger, well, not a little larger, it's a lot larger of an issue. Right now, the conservative estimates are that 22 of our heroes commit suicide a day. Of the breakdown of that, only between 5 and 7 are known to have utilized the VA health care. So you're still looking at a majority of those veterans who are committing suicide who may never have been touched by the VA health care system. And again, would that have deterred them from committing suicide had they had that access to VA health care? Those are questions we need to find out. We just don't know.
Do they know how to reach out, do you think, if there is a situation?
Well, we certainly have had some contradicting stories between the suicide crisis hotline. In some instances, it's worked. In some instances, veterans have been put on hold and they've committed suicide because they didn't have anyone to reach. Just recently, we had 4 separate incidents within our office where veterans could not access the crisis hotline, and so they called the Kentucky Department of Veterans Affairs, and our staff, although we had not been trained to handle such situations, situations, we did handle them, and we partnered with local law enforcement, and we successfully were able to de-escalate the situation. But we see, as I have partners in every state, we see that as a growing concern, not only for the federal VA, but for state VA as well. Just
before we sat down to conduct this interview on Friday, as it's airing this weekend, the U.S. Supreme Court ruled that same-sex marriage is the law of the land. That will have some implications, will it not, for state government and for specifically the Department of Veterans Affairs?
You know, you bring up a very unique situation, so I hope that we will be able to address this at our national meeting. So every state commissioner gets together twice a year, and our next national meeting will be in August and September. And it'll be interesting to talk about the dynamics of dependent benefits, so spousal benefits, how that will affect, and what kind of numbers that we think we may see on the increase of veterans health care and veterans benefit administration. So we don't have any numbers to date to see how that's affected us, but that's a very interesting situation. That, and also we're going to have to do a little more due diligence when it comes to transgender veterans and accepting them into the realm of the veterans community. We know from we have a couple Navy SEALs nationally that have written books and are transgender veterans. So all of that will certainly affect the benefits and healthcare industry, not just with veterans, but also in the civilian realm. But for veterans specifically, it'll be interesting to get some of those numbers.
Well, the traveling wall is coming to Kentucky in July, and we're going to talk about that with the Commissioner of Kentucky Department of Veterans Affairs, Heather French Henry. We'll be back on WKYT's Kentucky Newsmakers in just a moment. Welcome back to WKYT's Kentucky Newsmakers. We're visiting with Heather French Henry right now. She is the Commissioner of Kentucky's Department of Veterans Affairs. And I'm just learning by listening to you just how extensive the responsibilities of your department and your office are.
Certainly. We have a wealth of opportunities to take care of our veterans from the time that they get discharged to do disability claims and benefits. We have benefits officers statewide that cover the entire 120 counties of the Commonwealth of Kentucky. We also at the end of this year, we'll have our 4th Veterans Nursing Home online, so we'll have 4 long-term care facilities that house over 700 residents, 700 wonderful men and women of valor, and then we'll have 5 veteran cemeteries, and that's what we call our forever care. So from the time a veteran is a new veteran to the time they're over 100 years old and we may lay them to rest, we certainly can take care of them for the wealth of their life. But we'll have over 1,000 employees with the completion of that 4th Veterans Nursing Home. So around the state of Kentucky, it is we're quite vast when it comes to the employee pool and the amount of people that we touch on a daily basis. So administering all of that, we have a great central staff in Frankfort, but administering that when you have to get the word out and to do that as well becomes sort of a time management challenge. You know, how do you effectively do all that? So it's been a great role for me to be in. I certainly am privileged to do that.
Another initiative that you're part of is this alternative sentencing for veterans who may become involved in having committed a crime.
That's right. In 2008, Judge Russell up in Buffalo, New York, instituted the very first Veterans Treatment Court, which is an alternative sentencing court for justice-involved veterans who are nonviolent offenders. And here in Kentucky, we now have 4 implemented. We've got here in Fayette County, we have Jefferson County, Christian County, and Hardin County. And while those are overseen through the drug court program, certainly our department, through our general counsel, Dennis Shepard, and our homeless veteran coordinator, Trina Patey, and Luanda Knuckles, our very first women veterans coordinator, have agreed to be involved in a more solid way in reaching out to those veterans going through this alternative sentencing program to offer whatever assistance that we can. This program fundamentally changes lives. It takes veterans from the time that they're broken down, offers them a mentor, gives them a chance to better their quality of life, not through going through the normal justice-involved route by being jailed or in prison, but by getting them the treatment that they need and that they deserve and that's out there. So it's seen huge success across the country.
Commissioner, the traveling wall is coming to Kentucky. We have 116,000 Vietnam veterans in Kentucky, and this will give them the opportunity to do what?
One, to say thank you to their heroes, to their brothers and sisters on the wall. Currently, we have 1,104 Kentuckians who are listed on the wall. We have 14 that never came home that are still listed as POW MIAs. So this gives us a great chance to say thank you to those families for their true ultimate sacrifice and service. Also gives us a chance to help educate the community about the ripple effects of service to our country. You know, the wall is a very personal place of remembrance and healing. And just as my dad has told me stories about names on the wall, it's time for us to teach our children and grandchildren about sacrifice and service. And whatever you feel about the war, you felt about the war, but you have to feel strongly for the warrior. And these men and women who many were drafted, volunteered to go, did their due diligence, served their country, and over 58,000 of those names are now on the wall for that ultimate sacrifice. So this is a great chance for us to come out and say thank you.
The opportunity to do that is at the Kentucky Horse Park, July
9th through the 12th. It'll be open 24 hours a day, starting at 12 p.m. on July 9th and ending at 3 p.m. on July 12th, when the wall will be taken down. There's a variety of ceremonies and just even moments just to come to the wall. It'll be open 24 hours a day. Many veterans like to come in the quiet of the night, and the park will be open. It'll also have free access. If you mention at the gate that you're coming to visit the wall, there will be no parking fee for you. And it's by the Alltech Arena, by the soccer field, so it's going to be a beautiful location, serene. There's even sort of a pond right there we're going to look at as sort of a reflecting pond.
All right. Commissioner Heather French Henry, thank you very much. And the kids are now 12 and 14.
Soon to be, yes.
Okay. Wow. Thank you so much for coming. We appreciate it very much. We want to thank you for joining us for this edition of Kentucky Newsmakers here on WKYT, and we hope you make it a good week ahead. Our scheduled guest next week, U.S. Senator Mitch McConnell.